endoecological intoxication, or the world's population, introduction of a new clinical indicator, integral blood toxicity. Next slide, please. In recent decades, the environmental condition of human habitation have become the subject of close attention of the World Health Organization, WHO. The list of the most common and most dangerous environmental pollutants developed by the WHO includes the following substances: acrylonitrile, benzene, carbon disulfide, 1,2-dichloretan, dichloromethane, formaldehyde, polycyclic aromatic hydrocarbons, and many others. But in the air of cities, there are other substances that pose a danger of developing chronic poisoning, including those that can cause long-term consequences, reproductive disorders, and development of malignant tumors. Hygienic regulation is based on the postulate the concentration of a toxic substance below the MPC, maximum permissible concentration, is safe for humans. This is true for one-time impacts, but if the body is exposed to poisons every day, even in small concentrations, can it be considered harmless? What is the threshold of chronic action? And what if the cause of chronic poisoning is the constant and long-term use of synthetic drugs, which the doctor prescribes for life? Today, the diagnosis of drug-induced hepatitis is becoming one of the diseases of modern civilization and is the way out of this vicious circle. Next. For the first time, we have described the phenomenon of detoxification in the process of hirudotherapy, which makes it possible to remove toxins, both endogenous and exogenous origin. Toxins circulating in the blood can cause vomiting or death in attached leeches. The definition of zemstvo doctor for leeches that have passed the stage of blood sucking. This property of attached leeches allows us to consider the behavior after blood sucking as a method of assessing the integral toxicity of the patient's blood. Author's definition. The accumulation of clinical material on the topic of toxicity of patient's blood made it possible to discover a number of unknown patterns and new facts. For example, if the death of leeches in the patient after blood sucking occurs at 5 to 6 months of treatment, this allows us to conclude the patient's toxins are in the matrix, intercellular space. The doctor's task is to understand how the toxins got into the human body and accumulated in the matrix and how to remove them. And they could get into the matrix as a result of long-term treatment or with chronic poisoning from the patient's environment, food, air, water, contact during work. If leeches die from the very beginning of treatment, this clearly indicates that the toxins are in the circulating blood. Next. For example, when treated with preparations containing bivalent or ferric iron or other metals, as well as antibiotics, we will observe regurgitation of blood and their death in attached leeches. It should be noted that we will be able to observe the mentioned changes in the behavior of attached leeches only if we don't kill them, but observe them. by following by Ayurvedic rule of ahimsa. As a result of such observation, we receive unique information and answers to the questions. The first, does the blood of this patient have toxicity? The second, and if it does, where are the toxins located? Are they in the circulating blood at the moment, or are they in the matrix? To prove the above-mentioned concept, a number of clinical cases demonstrating the integral toxicity of patient blood will be cited in the presentation. And these results are extremely important when planning a pregnancy in modern women, especially those living in mega cities. Next. If we use this knowledge, we can significantly reduce the risks of giving birth to children diagnosed with neonatal encephalopathy of unknown etiology, not microbial and not viral. This problem is being discussed, and this topic is described in even more detail in the author's recently published book, COVID-19 Post-COVID Syndrome. A new problem that humanity is facing is environmental pollution with microplastics or nanoplastics, NP. Modern studies prove the bioaccumulation of NP in human brain tissue and its possible impact on neurodegenerative diseases. Studies show that more NP accumulates in brain tissue than in the liver and kidneys, with polyethylene being the most common polymer. In addition, patients with dementia have significantly higher levels of NP, indicating a potential link of neuroinflammation and cerebral vascular pathology. Polymer microplastics penetrate the blood-brain barrier and can enter and accumulate in the matrix, interstitium of the brain. And this, of course, is also becoming a problem of modern civilization. Next. Figure 1. Dynamics of leach death during treatment of patient with chronic dry pulmonary. Diagnosis: Krashenyuk form of epilepsy. Treatment period: 11 years. During the treatment, the accumulation of drugs in the matrix occurred, which lead to the development of the clinical picture of chronic fatigue syndrome. Therefore, with Hirudotherapy, leeches began to die only from the 5th month of treatment. The maximum death of leeches occurred in the 9th month of treatment. Next. Figure 2. Patient, 68 years old. Diagnosis: Stage 1 hypertension, intervertebral hernias, widespread osteochondrosis, prostate adenoma, chronic prostatitis, systemic connective tissue disease. From the anamnesis, 25 years ago, he worked with mercury and heavy metal salts in research laboratory. In this case, the leeches died from the very beginning of treatment. Next. Figure 3. Patient, 69 years old. Diagnosis: hypertension of 2 stage. Since 2010, she has been taking Duratone as a dose, 3.75 milligram, 2 times a day. From the anamnesis, he worked as a welder for more than 10 years. In this case, the leeches died from the very beginning of treatment. Next. Next, please. Figure 4. Patient 33 years old, diagnosis. Ovarian cysts, condition after 2 operations to remove the ovaries. Bad habits, 12 years of smoking experience. Follow-up period, 25 months. In this case, the leeches died from the very beginning of treatment. Figure 5. Next, please. Next, please. Figure 5. Patients 28 years old, multiple spinal hernias, bilateral mastopathy, systemic connective tissue disease, constant contact with triosep wet aerosol, alkyl diethylammonium chloride, didecyl diammonium chloride, glutaraldehyde, neongol, cocamidopropyl betaine. The follow-up period is 17 months. In this case, the leeches died from the very beginning of treatment. Please, next slide. Figure 6. In the Chernobyl zone, after the reactor explosion, an epidemic of female infertility arose. Ionizing radiation affected the tissues of the woman's body, which lead to the development of endotoxins and damage of the ovaries in the form of polycystic disease. Thanks to our technology, 3 children were born in this family after an Apgar score of 9 to 10 plus. Happy family from the Chernobyl disaster zone. Next slide. Figure 7. Matrix diagram with capillary cross-section. The matrix accumulates various toxins, endo and exotoxins. Endotoxins are caused by a long-term chronic disease. Next slide. Figure 8. Matrix interstitium diagram with content. Note the proteoglycan and glucuronic acid structures and collagen fibers. As a result of the action of leach enzymes, hyaluronidase and collagenase, the matrix becomes more permeable and allows accumulated toxins to diffuse into the capillaries. Next slide. Medical leech saliva contains a wide range of proteins and enzymes which have multifunctional effect in diseases. In the detoxification mechanism, leach enzymes play a particularly important role: hyaluronidase and collagenase. Next slide. Theory of medicine. The first, humoral, Egypt, Babylon, Hippocrates, Helen. Health is harmony of body fluids, eucrasia. Disease, improper mixing of liquids, dyscrasia. The second, solid, Greece, Erastus, Asclepius. Health is determined by the state of dolid structures of the body. The third, unification of solid and humoral theory, Italy, Giorgio Bajlivi, mid-17th century. The body is a closed physical system, the health of which is determined by the equilibrium between the vibrations and tissues and the flow of fluids. The fourth, Cell theory of pathology, Rudolf Virchow. Disease is physicochemical dysfunction and changes within one cell. The fifth, theory of molecular pathology, Schade, Busse-Gravitz. Health depends on the physicochemical state of tissues, on the swelling of connective tissue, the surface tension of certain membranes, the polymerization of basic substances, the permeability of capillary walls, etc. The sixth, theory of homotoxicosis, Hans Reckeweg. Disease is a state of toxicosis which is caused by homotoxins as well as protective processes aimed at the recovery of the body. The seventh, a new humoral theory of diseases by Professor Slesarev. Development of Rudolf Virchow theory. First, the water aquatic system inside or outside the cell gets thick, and then the cell gets sick. A new paradigm of medicine. Next slide. Dr. Hans Heinrich Reckeweg. Diseases are biological appropriate defense processes against endogenous and exogenous homotoxins. Next slide. Valery Ivan Slesarev, professor, doctor of chemical sciences, honored workers of higher education of Russian Federation, author of a new paradigm of medicine. Next slide. Findings. The first, a medicinal reach is a unique method for diagnosis integral blood toxicity. The second, the dynamics of the death of the touch leeches makes it possible to assess the source of homotoxins, their circulation in the blood or their exit from the matrix, intracellular processes, into the circulating blood. The third, the discovery makes it possible to observe any effects on the human body. The fourth, deep research of an interdisciplinary nature is needed to avoid giving to person of the future a plastic brain. Thank you very much for your attention.